National Education, Health and Allied Workers Union, Nehawu, is wrapping up their 3-day inspection at various hospitals in the Western Cape. This amid growing concerns over COVID-19 safety protocols and the lack of protective gear. ENCA's Aisha Ismail is at the Khayelitsha Hospital and she joins us now for an update on that particular story. So Aisha, concerns from the trade union Nehawu against the backdrop of the lived reality of the spread of COVID-19 in the Western Cape and across the country, and also concerns about the safety of healthcare workers becoming a real issue and coming to the fore.
That is indeed so, Thulasizwe, and it is for that reason that Nehawu has embarked on a 3-day site visit to various hospitals across the Western Cape, but also going to the South African Revenue Services and also to SASSA points to go and see whether their workers are being taken care of and whether COVID-19 health regulations are being carried out and practiced. And so they've been to Khayelitsha Hospital, they've been to Tygerberg Hospital. This morning they came to Khayelitsha Hospital. Now you will recall that Khayelitsha is a hot spot for COVID-19, and Nehawu has been saying all along that they're very concerned about their health workers, about frontline workers, saying that COVID-19 cannot be defeated without the help of health workers, and these workers are in the front line. But I'm now joined by the first Deputy President of Nehawu, Mr. Mike Shingange, here at Khayelitsha Hospital. Now, sir, you came specifically to Khayelitsha Hospital this morning. Were you happy with what you found?
Not exactly. We're not very happy. We have had a very cordial discussion with the management who appreciated our findings, because our view is that they still have a lot of work that has to be done, particularly when it comes to training of the workers in terms of the awareness, when it comes to screening. I myself, I'm sure even yourself, came in here. You were not screened. You were not asked your temperature. Therefore, we're posing a danger to the population here, but also danger to the workers. So those are the matters that the employer has committed to make sure that it must improve.
But you also visited Tygerberg Hospital in Khayelitsha. Did you find similar problems there?
Of course we did, particularly the area of protecting of our members in terms of the PPEs, the areas of educating them, but also the area of generally disregard of the rights of the workers. You know that these workers, public health workers in particular, at the moment are just about the most important soldiers of the nation at the moment. If South Africa is to go back to normality, you need to empower and support and strengthen these healthcare workers in order for them to defeat this COVID-19. So the lackluster approach that the government seems to be having when it comes to the healthcare workers doesn't seem to be demonstrating the seriousness with which we must defeat this COVID-19. So we're not very happy, including the fact that over and above the perpetual chronic shortage of the staff, when more and more workers get infected and go on isolation, it put more pressure in terms of the workload to those who remain behind and work anxious as they are, but at the same time they have to compensate for those of their colleagues who are now on isolation.
So how long are you giving hospital management to rectify all these problems that you have now found?
Most of the discrepancies that were found there have got to do with the compliance of the law or lack thereof. We were therefore given them not more than a week to correct them. We've promised them, and all of them they've accepted, whether it's Khayelitsha, whether it's Somerset Hospital, that within a week with no more, because it is clear there's no denial that what we are asking them to do is just to comply with the regulations as pronounced by the DPSA, World Health Organization, public service, and also the regulations that were brought about by the state of national disaster as proclaimed by the Minister of Health.
Thank you so much for your time, sir. So Thulasizwe, from here, the Nehawu delegation will be going to SASSA here in Khayelitsha and also to Mitchell's Plain Hospital, as well as the South African Revenue Services.
All right, that's ENCA's Aisha Ismail live with that update from Khayelitsha there. Thank you for that, Aisha. Let's move